The Big Story, I'm Dylan Ang. The place where people are getting infected by COVID-19 has changed since phase 2 of reopening on June 19. Previously, 71% of new cases were infected at home. This has dropped to 41% between June 19 and July 5th. Meanwhile, workplace infections now make up 36% of new cases, compared with 22% previously.
Employers should still have their staff work from home, and they should only come back to the office to work if there is a clear and demonstrable need to do so, because the employees need to use some specialized equipment or some machinery at work, right? So that condition remains, and I think that's one precaution that all employers can take, so that even if there is an infection happening in the workplace, it will not cause a large cluster, because the number of the transmission will be limited. The other precaution, as I highlighted, is that within the office setting, employers should make sure safe distancing and safe management practices are upheld. It's in the way the staff, employees are seated, but very often it's also in the kinds of informal activities that happen in the workplace, like in the pantry, in the office canteen, where people tend to let their guard down.
The multi-ministry task force also said that the number of linked cases in the community due to social interactions is low. This shows that the measures in place to stem the virus are working, but the task force cautions Singaporeans not to take it for granted and to remain vigilant. Another area that the task force is keeping an eye on are the symptomatic unlinked cases in the community. They were picked up from testing of people with acute respiratory infection. COVID-19 testing was expanded to all patients 13 years old and above who have ARI symptoms when they see their doctors.
These are cases that emerge in the community with no clear connection to any existing cluster, dormitories, or construction sector. They reflect cases with unknown sources of infection. And if this number goes up significantly, we should be very careful, as they may signal an increase in the underlying community transmission.
Mr. Gan, who co-chairs the task force, said cases are expected to rise as we are testing more vigorously. He also gave an update on the cluster at Block 111 Tampines Street 11. Testing was offered to 58 households and their visitors after 9 cases were found in 2 separate households in the block. So far, 118 were tested and all the results are negative.
Currently, while we are not seeing a second wave yet, the risk is always there. So we have to continue to be vigilant. To be honest, when we saw the cluster in Tampines Street, I was very concerned that this could be a major outbreak for us, because we have quite a number of cases within one household, and then it has some connection to the second household. We have not been able to establish conclusively what's the connection between that there would have been some connection between the 2 clusters, and there is also a risk that you could have a third cluster popping up from the Tampines group of households, and you could have a spread to other settings beyond just the households arising from this group, and then you have potentially a significant cluster in our hands. And that is why we decided to go beyond the usual public health SOP, and we decided to test everyone on that section of the building to give us an assurance that there is no other further transmission beyond this particular 2 households. And so far, the results are negative.
According to Mr. Wong, since the start of phase 1, 43% of cases remain unlinked. Among these, half are in the construction sector and other construction-related activities. The vast majority of these cases were found through active surveillance and periodic testing of construction workers every 14 days. Mr. Wong added that most of these cases were also detected through serology tests, which means that they were old cases.
And we are systematically clearing the workers in the dormitories. We are clearing, we have suspended construction activities for quite some time, and then only now starting to resume some of these activities. But the fact that there is such a continued high incidence of positive COVID results amongst these construction workers, I think remind us of the need to stay vigilant for this sector extremely vigilant, and that's why we have to do two things. First, we have to be very rigorous in the way we go about clearing the dormitories. The second precaution we have to take is to make sure that the contractors themselves put in place new management practices.
Responding to a question regarding the advisory that was issued to employers, Director of Medical Services Kenneth Mark clarified that the Health Ministry had engaged the Manpower Ministry to intervene and engage the employers based on feedback it received from hospitals.
I remember one of the chief executives from one of the hospitals calling me on the 8th of February to complain about how supervisors were bringing the employees and workers to the A&E department to be tested. They were well asymptomatic, and basically the supervisors were demanding for certificates and memos to be issued to these workers to deem them free from COVID infection so that they can then be allowed to go back to work. And they raised a lot of alarm bells among the senior management in the hospitals because, one, they could not issue such a memo in good faith. A single negative PCR test would not be able to confirm that any worker was free from infection at all.
Dr. Mark said that there were also concerns that the A&E department will be overwhelmed, as at the time more people with symptoms were being screened. Visit straitstimes.com for more stories from today's press conference. You can also watch the full conference on our YouTube channel. Subscribe by hitting the red button below. I'm Dylan Ang. Thanks for watching.